Food allergies are no laughing matter. When I was back in elementary school, we had one kid that we knew of that had an allergy to peanuts. Since then, it seems that millions upon millions of people are finding out that they too have allergic reactions to food. Something as mild as a rash, or something as deadly as full anaphylaxis. It's terrifying, and as a parent of someone with a food allergy, it's extremely concerning. Today's guest saw this trend, especially in America, and decided to do something about it. So we're going to talk to him about the business he started to help stop childhood food allergies. And also, please don't judge me and my wife's extensive collection of jarred candles. I'm quite aware we have a problem. Stay tuned. Hello everyone, thank you for joining my next episode of Business Over Brews. I'm very excited because I have a true entrepreneur in the studio today, Clarence Friedman. Clarence is the VP of Strategy at SimCon Lighting and formerly, as an HBS grad, developed a company of his own, Adeo Health Sciences, correct? Does that sound right?
Correct.
Thank you.
Yes.
Now that name might not mean much to you out there, but a product that they developed called Inspired Start might, especially for those new parents. Throughout that time frame, Clarence focused on developing a product that would help expose young children to controlled allergen substances to help build that allergy, to help actually end child allergies, which is such a great idea. Personally, it means a lot to me because my son, who is now 5, has a peanut allergy, and we're just working now to expose him to that. And now with our new son, we are exposing him already to peanuts being 6 months. And secondarily, congratulations for joining the COVID baby world here. You welcomed Graham, I think 7 weeks ago, correct?
That's right. Yeah,
not bad.
That's right.
We've got our 6.5-month-old, you've got a 1.5-month-old, and I'm surprised that you're actually up and functioning as a parent, let alone breathing. I remember being in your seat not too long ago.
That's why we need a drink, right?
Exactly. Well, which is good. That this is a good time for us to transition to what we're going to be drinking. And this is Business Over Brews, but as a fellow Scotch connoisseur, we had to do a whiskey. We had to do a Scotch. So I'm choosing the Dalmore 12, a personal favorite of mine. What did you bring on today?
I went with a tried and true Balvenie 12. It's not flashy, but I think it's one of the most underrated scotches there is.
I absolutely love the Balvenie, especially I think my favorite, we talked about this before, their 14-year Caribbean cask has always been a favorite of mine. But you cannot go wrong, anyone out there, with the Balvenie, especially if you're new to whiskey. I definitely recommend it as a starting whiskey, something that you can very easily get into. But instead of talking all about whiskey, what we're going to talk about here is pretty much the creation, the birth and success of this company of Adeo Health Sciences and the products you were selling, which you had a company, it was successful, it grew, you had about a 5-year period of this company, 4-year period, and it actually got sold. And so before we get into the entirety of the program, personally, to start a company, to be an entrepreneur, it's difficult, it's challenging, it's scary. Have you always had this entrepreneurial mindset? Have you always been building lemonade stands per se and trying to get customers and acquire market share? How did you really get into this entrepreneurial way?
Yeah, my parents are entrepreneurs, so it definitely gave me It gave me the concept, it demystified the idea that it's possible. A lot of people think about starting a company as such a far, such an unattainable task. But they raised me while starting a business, and so I knew it was possible. I think I always was going to take a shot at founding a company, and it felt like the right time to do it. Coming out of graduate school before family, and just I can put in those 80-hour weeks without any expectation of return. You can only do that a couple times in your life. Yeah. And so yes, there was always the plan to start something. And this particular idea came really out of a dire need. I can get more into that if you'd like, but
I'd love to. That's really the next question I was going to ask, which is the idea itself. How did it come up? And of course, your mention of the 80-hour weeks, those are gone now that you're a father. Those, I mean, you're always on, but those 80-hour weeks, don't expect to pull those much more.
Yeah, absolutely. So Adeo really was born out of the fact that 1 out of 13 infants developed a food allergy. That had tripled over the last 10 years before we started. That was in 2015. Wow. And it just felt like such a public health crisis. There was no discernible reason for that to be happening. Mm-hmm. The best things that people could come up with was this hygiene hypothesis, meaning people were too clean, they washed their hands too much, and they didn't get exposed to germs and things. And I believe that. I
Sure.
am I do buy into that. But what also created that havoc of so many infant allergies was that there was a guideline in 2010 that was published by the American Academy of Pediatrics that said, do not feed allergens to your children before they are 3 years old. And that made no sense to me. So before I was a sellout business guy, I was a biochemist. And so my alarm bells kind of went off, and I was like, this doesn't make so much sense. When your body or when an infant's immune system is learning to develop and train itself to know what's a good thing and what's a bad thing, that's probably not a great time to withhold something that you don't want to be overreacting to. So we thought, what if the simplest answer to this, tripling of allergies was just getting people to have allergens early? What if that was just it? So went down that path with a few scientists and professors that I respect. And the consensus was pretty clear that there are geographies that have allergens in their diet much earlier on that just have a dramatically lower allergy rate. One of the best examples was Israel. So a lot of Israelis feed their kids bamba, which is basically a peanut Cheeto, and their incidence of peanut allergies is about 10-fold lower. So that was kind of all the data I needed to say this is a solvable crisis. And so, if there was someone that was going to do something about it, they might have the background of a scientific degree and a business degree and have, the jumping off point for it. And so I thought, why not? Why shouldn't this be me? So it helped that I also had a personal impetus for it. About 3-4 months before founding Adeo, my cousin was diagnosed with peanut allergies, and I know for a fact that my aunt's pediatrician was one of the folks that said don't introduce allergens until later on, and it just was kind of personally infuriating at that point. And so we made it a mission to make sure that as many parents that we could educate and as many parents that we could empower to do safe, controlled, early introduction of allergens, the better. So that was the genesis.
It's interesting. If I look at my children now, I have a 5-year-old and now a 6-month-old. When our 5-year-old got diagnosed with a peanut allergy, we noticed it because we gave him some around 1 and he developed a rash. So we decided to see an allergist. At that time, in 2015, going into 2016, they said, hold off from any exposure. We're going to test in a year and see if it gets worse. Right now, it's just a rash, but tomorrow it could be anaphylaxis. So it was panic. Don't do that.
That's so scary. I mean, it's extremely scary, and that was part of what we tried to help smooth over, because you can't get over this particular issue by being scared. This early introduction is the only thing that was statistically correlated with prevention of food allergies, and that's a tough thing, because the one thing you're scared of most is the one thing you might need to turn to. But
exactly.
That data didn't come out until after our founding. So we were vindicated about 2-3 years in when things like the LEAP and the EAT study came out. But I don't need to talk too much about the business in general.
The reason why I find it a little, not to say funny, I mean, not that allergies are funny, but when having that information given to us about our 5-year-old, going in literally a month ago to my new son's pediatrician at 5-6 months old, he said, buy him Bomba. He literally said, buy him Bomba, get him exposed.
A lot of that was Adeo. A lot of that was us in the educating of physicians, pediatricians in mass that they need to change their thought process. So I'm glad.
It's awesome, and it's huge, because now we are actually, based on the science, we are in control, exposing both children and checking to see what the actual exposure is like. Thankfully, our son, who had the allergy, had never been anaphylactic. They never had an anaphylactic reaction. We're loaded with EpiPens. I've probably got 20 expired ones since we've had to get the panic of the EpiPens. But it's interesting that just even 5 years, what a difference that can make on people deciding what is safe and not safe, especially when it comes to children and exposure to these allergens,
Absolutely. Things move quickly, but not in medicine. So
well, you don't want to move too fast.
It changed quickly once the guidelines changed, but people have been battling for quite a few years.
Well, I can imagine. I mean, even in the medicine industry, you've got plenty of conflicting reports, and you just try to go with the majority. And then when something new happens that's a minority, it has to be vetted so thoroughly before you turn around and accidentally kill people. People's lives are technically on the line, but it's the best way to move forward. But moving forward into what you did next. So, your cousin came down with a peanut allergy. It gave you this visibility into something, a business you're looking to start, something you're going to be passionate about. Now, baby food, or not even to talk about baby food, because eventually you do go into inspired start with baby food. But did you initially decide, let's go into producing a consumer-based baby food? Are we looking to create a different type of administrative medicine? Is it through injection? Is it through physician prescription, or in physician office prescription? How did you decide what the medium was to expose people to this?
The first iteration of the company was a purely pharmaceutical company. So My background was in drug discovery, and our initial thoughts were that this was going to be more of a vaccine model, where every child would get this, even in the hospital, just have a certain controlled dose with certain adjuvants, and make sure that their immune system was properly trained on allergens, right? Sort of out of the gates. Now, unfortunately, the medical system that we've set up in the United States really does not reward prevention. In fact, almost no insurance will cover preventative, whether it's medications or vaccines, unless they're mandated by the U.S. government. So when you get a measles shot, that's because the U.S. government says that insurers must cover that. But if left to their own devices, they're not going to, because basically you could imagine a world where that was true, and because we have such a private healthcare system, you could get preventative measures on one and then move to a cheaper plan that doesn't provide it, that you don't need it anymore.
Exactly.
And so they don't get to reap their own benefits. And so that's just really tough. And because that was true, we were gated out of doing a sort of pharma approach where this was going to look more like a drug. But it ended up being the right decision anyway, because as more and more data came out about early introduction being the singular most important thing you can do for your infants in terms of future food allergies, when that data started coming out, parents kind of quickly shifted their interests, their wants. So I remember we took a team out for what we call a dash day. We took everybody out of the office for 2 straight days, and we stopped 100 parents on the street, and we asked them whether if 2 companies existed, 2 products existed. This was a hypothetical at the time. If 2 companies existed, one was going to give your kid a shot at 2 days old, with defined, clinical boundaries, guidelines, and, basically a shot of peanut, or would you like to find it in a controlled, delicious organic fruit puree in Whole Foods when your kid's 2 years old? Overwhelmingly, overwhelmingly, I think it was like 98% of parents said that they would rather have sort of the conventional food option that was a little bit more empowering and a little less scary.
Yeah.
And so regardless of the economics and the medical industry's predilections, parents just wanted the more organic conventional food approach. And so it ended up being the right decision for a number of reasons.
Nice. And so you're deciding, all right, let's go with food. We might see a cat pop in here. I apologize. But so, you decide to go forward with a food, something that's over the counter, so not specifically over the counter. You're not at a pharmacy to have to get this. But you're deciding to enter the baby food market. Are you looking to produce something that is actually a baby food? I apologize for my cat. Is it something you're actually looking to get into, the baby food competitive market? You've got Gerber, you've got your Enfamils, you've got your Similacs, you've got plenty of jarred baby foods. Are you considering them competition, or are you creating your own segment? This is specifically for exposing children to allergens to get them through and get them acclimated to them, and then that is it? Or are you looking to turn into a primary food source for these babies and infants?
We started thinking about that a little bit later in the trajectory, but it was important not to lose sight of why I founded the company, which was to help prevent food allergies. So do what it takes, be in the market, be in the industry, in the segment that you need to be in order to deliver that health outcome to the population, and then kind of worry about the rest later. So that's how we approached it.
So now that decision, like you said, it was much later. At some point, you have this idea. Where do you go next? Do you get funding? Do you try and build a team? Do you build a small team to put together some sort of minimum viable product? I mean, you're developing a consumer good that people will buy over the counter. There's a lot of manufacturing. There's a lot of overhead. You've got plenty of costs that are associated with that. This isn't a software company that you can pay a developer to do something over a weekend and have something good to go on a Monday. You have a lot of planning and a lot of overhead to get together. At what point did you decide, was it a couple of you then deciding to go get funding, or did you decide to go get funding yourself, and through the funding process you were asked to bring in certain business leaders?
Yeah, great question. Trying to think back to the early days. I remember sitting in a cafe interviewing, 10 people a day to be my co-founder. Wow. But at that time, we were a pharma company, so we sort of brought on a little bit of a team that had a lot more biochemistry focus, that a lot more deep scientific expertise. But when we started to realize that wasn't the best approach, and the more beneficial approach is going to be the food approach, we started to shift our team composition to a little bit more consumer packaged goods. That really came in full force after the first major financing round. So first we did an angel financing round. I went to a couple angel networks. I had already worked with a couple angel investors in the Boston area. I ran a small consulting company that helped them do diligence on Boston biotech companies. And so I knew a few biotech angels in Boston, and we put together a $250K round to help us get sort of a minimum viable product, which at that point was only helping to introduce peanut allergen to babies. And when we had that, we launched it. It was doing fine. And then we really had this product conceptualization and all the data, all the purchase intent data to say that when we became a multi-allergen, like early introduction for all the top 8 major allergens in organic puree format, that was going to take off. And so we trusted the data, and we went out to raise a 2.1 million round. And we did so through just VCs. Had a couple excellent VCs behind us. And at that time, we started to bring on more experienced consumer folks who had been in the retail industry, who had designed products, and we're sort of those award-winning creative types.
Nice.
And so, it was an excellent team. We still all keep in touch, and I don't know. It's one of the best teams that I think at least the Harvard iLab had ever assembled. We were just really excited to be shoulder to shoulder.
Not bad. With that angel round, for the $250K, did you guys pay salaries or were you just trying to get something together?
I didn't pay myself, but yeah, I was on unemployment for the beginning of it. I didn't have any insurance. I didn't have any insurance, and I was on unemployment.
So you're just being very careful, watching where you step, don't get hurt.
Yeah, that my girlfriend at the time, now my wife, was like, just don't get hurt. Just don't do anything dumb. And I'm very prone to doing dumb things. I rock climb and, I put myself in high risk scenarios, but, no,
yeah, that's a little tough.
A little bit more safe. Trying to be a little more safe. No, we paid a lot of folks. We had branding, we had consultants, we had employees that help build the productization and the supply chain and the just the branding around it. And so that all came together out of that $250K, but it was mostly for the just singular peanut allergen.
Nice. So not to keep us back at that, but you said you bringing up the supply chain, getting everything in order. Are you at that point speaking to manufacturers? Where do you exactly go to find a place to manufacture baby foods for you? And then on top of that, produce such a unique product where you're adding in your own allergens? Did you work with a global firm that supplies baby foods to multiple producers or multiple vendors? Did you build something on your own? How did that process work?
Yeah. So when we were early in the process, still nobody wants to work with allergens. Because then you got to write on every other product that comes out of that factory that may contain, an allergen.
Sure.
Let alone every single allergen in the top 8 allergen. Like you can imagine anything out of that facility being like may contain peanuts, tree nuts, shellfish, soy, wheat. It's a disaster.
Yeah.
So it was extremely difficult for us to find a manufacturer that would bet on us, essentially, because you got to learn to make the product together. You have to have all the batching instructions and create, standard operating procedures together. And really, people wouldn't bet on us. So we called over 300 manufacturers and basically got about 3 to say yes on a good day. And one ended up being our partners. And we're very grateful that they, bet on us, and I think it worked out for them.
Do they produce products for do they manufacture for the brands?
Nice. They do. They manufacture for other brands. They set us up with a separate section of their manufacturing plant, like a little side room.
Yeah.
To start. Yeah. Until we could gain the capacity for the whole major line.
Nice. I mean, you get to a point where if you're doing that, every product they put through has to have all those warnings for every for every brand that they do the manufacturing process for. So that is a big commitment. That's pretty awesome. Now, at some point, you're manufacturing the product. Even before you started manufacturing, did you have samples you tried? Did you make anything at home? How did you create these were you guys just at your home in your kitchen mashing up apples and here's a shrimp?
Yes,
like
absolutely.
There was one that was like pear and cod or something like that. I think I have it written to it. Is it? I don't have.
There's a tough one in there.
It was mango and cod. That's what it was. I found it in my notes.
Mango. Yes. So we needed to do that because whitefish is actually one of the top 8 major allergens. So is shellfish. So we had some debates about how we would introduce those foods early on, even though they don't sound awesome. But we got to do it, right? So. We worked with the flavor house to formulate some of these, but the first iterations we did ourselves. So we bought the purees, we bought the allergens from different sources, we mixed them, we put different flavorings in them, and we just had these matrices. We'd go into the kitchen, we did a communal kitchen at the incubator that we were working out of, Mass Challenge at that time, and we just had these arrays, and we would every day the whole team would go and just kind of score which ones they liked better, and then eventually we brought them to parents, and then we brought them to a professional formulation. There's people who specialize in flavoring things, we got those back, and we did more consumer tests with parents, and eventually we got our formulations.
So you guys all tried them, right? Even though it's baby food, you guys all had to eat baby food, right? Yep.
Every day for months. Yeah.
So at what point, because, cash is tight, do you guys realize where it's like, I don't really have money for lunch, so I'm just going to rip something out of the fridge at the office and just have some baby food for lunch. Or was that a no-go?
The apple peanut is always just delicious. That was
Nice.
a go-to. So is the tree nut, the banana tree nut. So yeah,
That's
I've had
cool.
those before for sure on a tight day, but not because of. At that point, we were probably off to the races, and nobody was worried about their next meal. But it was still sometimes you forget lunch.
Yeah. Jeez. And now, I'm assuming at some point, someone in the room had to raise their hand and say, hey, we're about to make a product that potentially is supposed to put someone in the hospital at some point if they have a real bad reaction. And that, one, is terrible it's awful for the child, awful for branding, awful for your PR. And then potentially there are lawsuits behind that. How do you get a company like that insured that, if you go to like a certain theme parks, they'll make you sign these waivers every time that say, death and dismemberment, you won't hold us liable, things like that. You can't exactly have your customers sign something like that every time they buy a package of your product. So,
Right.
I mean, at what point when you decide, when you discovered, you are technically sending out something that could really hurt someone or put someone in the hospital. How do you handle that?
We knew the risks. I knew the risks at founding this company. Yeah. The problem is somebody has to do this. Somebody has to accept that risk of helping to introduce allergens because, again, it is the only thing statistically correlated to preventing food allergy development. So somebody has to do this. And Gerber won't do it. Any of the big guys won't do it because they have too big of a brand portfolio that's at risk, and their risk tolerance for any new product, it doesn't even have to be health related, but any new product is just much, much lower. So we knew that we needed to, and that was part of the value proposition of Adeo. And frankly, I think it's a value proposition of startups in general is risk arbitrage. A bigger company can't go do something new because they have too much at risk, but a small company can try it. And if they fail, it's, they've only failed with so much. Now, to answer the real question of being a potentially dangerous product, we have three major things we thought about. The first two are boring and unimportant, and the last one was the most important. The first one is legal liability. It's boring, but you just have to know what you're covered. So
of course
we talked to many lawyers, and essentially our liability is the same as peanut butter. We're telling you to introduce allergens early. We're helping you do that, but we're not telling you that do this in the absence of a medical professional. You're going to introduce allergens. At some point, you're going to introduce allergens, and we'd like to be the first, but you should consult a physician before you do that.
Of course.
And so we crafted language around introducing allergens and making sure that you spoke to a physician before introducing any new foods. Mm-hmm. And then if you experienced reactions that looked like this, and this, that immediately call a healthcare professional. And so that's boring thing number one. Boring thing number two is to have a PR plan. So there's the blocking and tackling of having prepared statements and action plans if, God forbid, somebody did get hurt and they didn't properly understand the risks. And so we had that all in place. And now the third is the most important, and that was really just the most important, which is having excellent customer success, having excellent customer support. So we made sure that all of our service times for picking up the phone were less than 5 minutes, no matter what.
Nice.
No matter
That's
what
good.
time of day, forever. So we would do that and make sure that we were with any patient that had any rash or any reaction as quickly as possible. And we had a playbook of helping. So where were their nearest allergists? Where is their nearest hospital? And making sure that we, to the degree that we told them not just to hang up and call a healthcare professional, but when they called us back, that we could actually help them down their path. Now,
awesome.
I remember all of us were up at night, thinking about this because we're good people, right? We don't want to have a family on Inspired Start succumb to an allergic reaction that's just terrible, right? But
of course.
So having that top of mind is just important as a cultural company value. Is written right into our values, of course. The family comes first, and how that manifests is that we were just scared all the time, and it's a company killer, and we don't want it to harm individuals. Now, it actually happened. The first time somebody had a severe reaction was about 6 months into the launch of Inspired Start. The parent called us with their child's in allergic shock, anaphylactic shock, and we immediately told them, of course, hang up and call 911.
Yeah.
They went to the hospital, and they called us back the next day. We helped them link up with a nearby allergist that we tremendously trust, and they got on a path to a treatment plan for their child's newfound allergies. And so that was sort of the core of it. But what was the most important of all of this was that the parent posted an Amazon review that same day, the day after they went to the hospital, and it was a 5-star Amazon review. They said that I've never felt safer than with
Sent
Inspired
my kid
Start.
to the hospital, 5 stars.
Yeah, that was unbelievable. So, they said
awesome.
When we arrived at the hospital, we knew exactly what had happened. We knew that, and I brought the pouch. We brought the pear egg pouch to the physician. They said, "Oh, it looks like your child's allergic to egg." And they said, we would not have known that. We would not have been able to do that. We wouldn't have been able to identify that in any other food. And there's egg in everything. So they were judicious enough to introduce egg for the first time with our product. And so they knew exactly what the allergic reaction was too. And they had a controlled small amount while they were watching their child. And they said that their journey through this process, they imagined other scenarios of introducing allergen without them knowing it, or in a higher dose without paying attention. And they sort of shuddered to think of what that might have been like.
That's awesome.
Because this child had a severe reaction. So they said in their review that there's a small list of companies that they trust, and Inspired Start is at the very top. And so that was incredibly meaningful to us and incredibly validating. And it was awesome. You go to sleep every night being like, is this the right thing for the world? Statistically it's the right thing. Everyone should introduce allergens, but to be that entrepreneur, to be that company, all of us, everybody on the team felt that burden of doing the right thing for each family individually. So tough tension, but it worked out.
It energizes you to keep you going. You're doing the right thing. You're helping people. And that's a huge deal on making sure, especially early stage in a company, to get that motivation going to keep you fighting for the place. Now, you mentioned, of course, building out a great customer success team. So at some point, you had to start hiring a lot of people. Now, I'm assuming it wasn't your first round of funding. Most likely after your second round of funding, that's when you started really building the team. What was it like? Where did you start hiring? What departments did you build out first to make sure that this would be successful?
Yeah, I have a very simple hiring philosophy, and it is to ask every single person you know who the best person they know is. And then you just find a seat. And then you just find a seat on the bus for them. Yeah. And so when you get a little bit more into the more senior positions, obviously you have to have some dedicated, discrete experience.
Sure.
But that's much later. By the time you really need, because you can solve most of the other stuff with advisors and consultants. You don't need to have done everything on your own. But it's a great way to build leadership and a pipeline of excellent leadership to just get A players on early on, and then let them grow into the different roles. Because in a startup, you have no idea what their career trajectory is going to be. Nobody does. We had somebody work for us named Juliana. She was basically out of college. She started basically as an intern for us. And then within 3 years, she was managing our whole grocery distribution network.
Awesome.
She just went through everything in marketing. And that was sort of a microcosm of everyone's growth through the company, because you just get awesome people, and not only will they figure it out, but they will grow into the roles that you will identify as a need later on. No startup will know what they look like 3 years from today. That's just You can't do it. So your philosophy, at least my philosophy, was to just get incredible people. So that was kind of how we went to go fill out the seats. I'm fanatical about talent. There's a person on our team who used to joke when I met them. I was at a Northeastern co-op career fair. I still went as the CEO to all the co-op career fairs. And one of the years I stood up on a desk in the middle of the auditorium and just yelled about what our company was doing and the fact that we just raised some funding and that we were going to change allergies in the United States. I just yelled just to a whole gym of a couple thousand people. And Then we had a line of people. We had a line of people at our desk. And the person who we ended up choosing as our Northeastern co-op was just such a rock star. He was just so awesome. He stayed with us for many, many years. He just remember, he was like, I wasn't even here. I was getting lunch. He was like, I was getting lunch. I wasn't even going to the career fair. And then I had to come take a look at what you guys were doing. So I think
all because of your yelling.
Yeah. So I think you just have to be fanatical about excellent people and, just complement with skill sets either from senior leadership that you do bring on eventually or with consultants and advisors.
No, I love that. Ask people who you think are the best. That's
I think
a
the West Coast
way.
I think the West Coast mentality is different, by the way. I think West Coast mentality is like hire somebody for $350K right away and just get the best, right? Go poach the director of product, get the iPhone's, product manager. And you're like, you can't, I mean, that's East Coast startup mentality is different. It's more like build it, grow the team, build it in more of an iterative fashion. So we adopted that school of thought.
We constrain our budgets a little more than they do out in the West Coast.
That's why we don't end up with something like Juicero, but that's a different story. Juicero is a hilarious company. I don't know if you know, they raised like $1 billion from every major VC and then they died in like a year and a half. It was one of the dumbest companies ever. Anyway.
No, never. But it sounds, I never heard, I love the name, but it reminds me of, what is it, Quibi, which was like this content syndication platform.
That's a current one, so I can't bash it too much, but that's not going well. Yeah.
It's currently gone. They actually are.
Oh, it's already gone.
I think earlier this week or last week, they announced that they're shutting down the platforms. But that is a complete different topic and different episode. But as I lose my train of thought here, you're talking about building out the team and whether or not this actually would have come out before or after, but you have to figure out what markets you're going after and how you're approaching those markets, how you're actually bringing those products to market. Now, people are buying these consumer goods. Are they, you mentioned at one point you could pick these up at a Whole Foods, but there were a couple of different channels you could go with, correct? You could work directly with physicians. You could work directly with pharmaceuticals. Could you sell direct to consumer? Or is it worth buying shelves, which is expensive in grocery stores? How did you think of what approach to go? Did you go a little bit with all of them? And theoretically, would that approach have shaped the different skills you would have hired in your team?
Definitely. We did a lot of channel analysis, spreadsheets, qualitative conversations with folks, and arrived at the fact that we needed to have physicians on our side. We needed to make sure that pediatricians knew about us and made sure they endorsed us, but that it was economically infeasible to sell through it physicians and to convince each and every one to either sell or specifically endorse the product. Yeah. A physician sales force is extremely expensive, and you can't have the margins of a baby food company and expect to reach every single pediatrician with boots on the ground. It won't work. Yeah. Likewise, if you're just a baby food on a baby food shelf, it's not enough because you won't get noticed, you don't have the awareness, and ultimately most parents are going to ask their physician if this is a good idea. So you need a combination of reach and awareness. And so our awareness came from working with physicians and working with some mom bloggers and influencers. And then our reach and distribution came from grocery delivery and e-commerce. So we did a lot of Amazon. We did a lot of our revenue on Amazon.
Nice.
And almost none direct to consumer. We did almost nothing on our website. I think it was like 4%. Wow. At the end there, just because people don't buy consumables unless it's on a subscription model, like directly from a website. But for a lot of reasons, parents preferred to just buy things on Amazon. You already have your credit card loaded. It's such a low purchase price. We had like $25 for our purchase price of an 8-pack, and it was just not worth. It was not worth going to a website trying to find it for cheaper or something. It just, this is going to help prevent a kid from having allergies. Like, one-hand checkout, of course. So we did one of the tests that we did, and I talk about this in other places sometimes, but we did this test where we handed every parent a card. This is my scientist's roots, right? So everything has to be an experiment. So we tested whether Amazon or our direct-to-consumer website would be our best channel for digital selling. And so we gave every parent a card, and on the front of the card said you have 15% off on our website. Go here to redeem the code, and here's a little bit of Inspired Start. And at the bottom, we also had available on Amazon Prime logo on the bottom right.
Nice.
It was like 95% of parents purchased on Amazon. They didn't even go to the website. As soon as they saw that logo that said available on Amazon Prime, they just went straight to Amazon Prime. Nice. Forget the 15%. And we could make that 15% all the way up to 20%. Still, nobody went to the website. It's just,
very interesting.
It's so funny, the purchasing behavior. I mean, it's just, people on Amazon. So that was the distribution for our e-commerce, was primarily Amazon.
Not bad. And it makes you wonder almost, you look at the approaches of Groupon in a way where a certain discount amount, whether it's dollarized or percentage, has to be over X number for them to actually take you up on the offer. Do you think there would have been a % off that people would have finally tripped over, or would it have to be 40%, 50% off for people to get from the site?
Have to be something unprofitable for us.
And then you're not making any money.
Something like 40% off, But it was already unprofitable for us. We actually do an entire HBS business case on this. I'm sure you could find it or download it somewhere. But
I've read it, and I will link to it in the comments
in
the description of these videos.
Not to give too much away, but one of the difficulties is the direct-to-consumer shipping. So when you ship something yourself across the country, it could cost you almost $8. And if you're shipping a $25 product for $8 to a consumer, it's just not worth it.
That's a lot.
If you can ship in large pallets to an Amazon warehouse, and Amazon can deal with the last leg delivery to a consumer, you actually both make more money. So we made higher margin when we sold through Amazon than we did on our website, even at the same price.
That's not bad.
Even when we gave Amazon, their 20% margin and paid their marketing fees and whatever, just because they saved us so much money on shipping. So
that's right. The last mile makes such a huge difference in how successful your product's going to be. Not only that, but just on the margins. So we're talking about your distribution. Using Amazon was fantastic to get your product to consumers. Now, looking at the market, what are you looking at for competition? Are you theoretically going up against your Gerbers and your Enfamils like we spoke about? Granted, more Gerber Enfamils powder-based versus your jarred foods or other packaged pouch-based foods. Pouch-based is fantastic, by the way. They're so easy to move around with. Kids can feed themselves. Who are you considering competition? Is it these other baby food markets? Or are you considering yourself something that is more supplemental? You give, people or parents will buy these to give to their kids once a week or once every couple of days, as opposed to a source of nutrition. Who were your competitors at that point?
That changed during the life cycle of Adeo. But I would say the most important competitor we had throughout all the phases of the business was non-consumption. So we're against people who don't know we exist. That's our competition. There's so much market size out there. It's 4 million births per year, and we estimated that maybe a couple 100,000, of those families knew about early introduction, even at the end, even in 2019 when we were required. So there was so much left to go. to educate people on the fact that this existed and they need to go seek this out. So market growth, talk about like growing the pie or getting a bigger slice. We really needed to just grow the pie. So that was our main competitor, is just awareness campaigns. And so we didn't really pay too much attention to what other folks were doing when it came to product building. We of course kept tabs on other folks. So towards 2016, we had another major competitor come out before brands. They had a powder-based solution that introduced all the allergens at once to your infant. For a variety of reasons, I think it's not a great solution. But
well, then how do you figure out which one did it?
Exactly.
Right.
Exactly. And so we felt as though we were a superior product from that perspective. We were also organic and existed in grocery stores where they went for a more direct-to-consumer approach. But nothing to detract from them. We all have the same goal in mind. We're all trying to solve this public health crisis of allergies. So we're all kind of on the same team because the pie just really had to grow. But so them and then a couple others, I'm sure that you could look up that do early introduction now, but we were completely alone for a year and a half.
Nice. Nice blue ocean to work in.
Yeah. So, but we also had to help convince these first physicians that this was a good idea. I was told many times that we were just going to kill kids, get out of my office, what are you doing? This is not the regulation right now. The regulation is to wait. Why are you talking to me about early introduction? So we had to do a lot of that wave breaking. Yeah. But the competition in the middle was kind of, major. There's like the extra competition, the people who also joined the space specifically to introduce allergens. I would say at the end, we started to think about Gerber and Happy Family and Plum Organics as being our competition because they could do this as well. They could go into early introduction. And so because we were proving out the market for them and proving that this was not only safe, but that parents wanted to buy it, then we were creating competitors because we were demonstrating the market need. So at the end, we started to think about them more as competitors, but kind of.
When you start generating success, people smell blood. They gravitate towards it. That's how it works. And so you brought up an interesting point. Of course, awareness across the consumer base to parents is a huge part. But again, getting buy-in from a lot of physicians. How often would you even have an idea of, or an estimate of what percentage of physicians are on board with early intervention versus or early exposure versus a wait and see approach?
On that.
Yeah,
we did surveys, periodic surveys on that, and when we began, when we first launched Inspired Start, it was about 15% of physicians said that they are actively for early introduction.
Only 15%.
Only 15%.
Wow. That's a tough battle.
What was more scary is that 50% were actively telling. It was like 55% actively were telling parents not to introduce allergens until 3. Which Then there's like the middle ground who, if a parent came in and they said, "Is this okay?" they would say, "Yeah, sure," whatever the parent said. So they were kind of they just didn't have a recommendation. But what was really scary is that so many physicians were actively saying the opposite of what needed to happen. And then towards 2019, we saw 65% were actively saying introduce allergens. So really big swing.
That's huge. Just over a year, 2 years. That's to see that change grow. And I feel like, especially in the medical field, to see a change like that happen over just a couple of years is astronomical. But of course, you do have data from other countries showing, valuable, accurate data that you can't really combat against based on what you're doing in the U.S. versus, like you said, I think in Israel, a lot of European countries as well tend to introduce allergens like peanuts and whatnot into children's diets very early on, which is insane.
I was still mad. That 65% was as high as we'd go. All the data was there. Why wouldn't 100% of physicians have read all the data and tell parents to introduce allergens? It was infuriating. And maybe that's just my, the just me as an individual. But yeah, it was frustrating. I know it felt like a big win, but there's still, 45% of physicians out there not telling parents about something so statistically obvious. So, but
old habits die hard.
A lot of progress. That's true. Old habits die hard.
Yeah. And the thing is, you'll even see now, and the whole joke about eggs. And I remember growing up, 85 forward, hearing different studies. Eggs are good, and then eggs were bad, and then eggs were good again, but then just the yellow was bad. And it was so inconsistent. It drove a lot of distrust in consumers in a lot of these food studies that a lot of them just kind of went numb to it and would stop listening to new introduced information, no matter how accurate or compelling it may be. People honestly hear these studies and think, well, next year it'll be disproven anyway. But that's just, again, there's another argument to how much promotion and awareness and benefits are brought into trying to get studies that get good headlines to help boost a company's bottom line who are making pharmaceutical products. Again, a whole other discussion in a whole other video. But let's talk about growth. Again, the company started in 2015. It ended up being sold in 2019. What was growth like? Were you seeing, just marginal growth, huge spikes, good hockey stick?
Step function. Yeah, we had pretty step function growth because the way distribution works, when you get Whole Foods distribution, or you get Target distribution, you're unlocking 10,000 doors sometimes. And that's just such a step function. So yeah, we had, we would have 6 months where sales would be just like ticking up because Amazon was, selling more, and we would sell more direct to consumer. A couple stores that we had piloted with in places like New York. I remember these small stores we started in New York, West Side markets, and we could see like small incremental shifts. But then we would unlock 500 new grocery doors and 2,000 grocery doors, and it was just such a big change. So the step functions were it was more jarring. We would have to organizationally get ready, from a supply chain perspective, from a marketing perspective, from a channel management perspective. At each one of those inflection points where a big retailer came on, we did need to change and upgrade.
I know you can't get into specific revenue numbers, but looking at growth, what was the growth like for the organization? Were sales increasing, 5, 10, 20% year over year? What did you guys define as success?
For us, we, like any good startup, we had specific revenue targets that we would set out at the beginning of the year, and we would execute against them. For us, it was not smooth revenue growth, though. So for companies that have large contract sizes, so maybe they're SaaS companies, for us it was distribution based, meaning when we signed up like Target or Whole Foods, it was just such a step function change to our revenues because you just have instantly 7,000 new grocery store doors that you're available in, and so it wasn't the work that you put in wasn't always correlated to the revenue growth, and the customer excitement wasn't even always correlated to revenue growth because it was just so distribution oriented. So I remember some of the biggest moments for us were when we got the first big grocery store, which was Whole Foods. Nice. Was super excited when I remember when we were sitting around the table and we found out that we got put into Wegmans. We got cross country in Wegmans.
That's cool.
And it was just, those were big step function changes for us. So in terms of growth, I remember, we were basically like 7 people in the company when we were doing like $300K in revenue, like just 6 people, and not even. And then, when we started pushing past like $1 million, we had raised new financing and we brought on a lot more people, and we were more like 25.
Nice.
So we were still really lean. And then, the higher levels, when we started signing up the larger grocery stores, we we added more people and grew the team more, but we were more focused on getting that distribution and then ramping up organizationally after we won, because I think a dangerous thing a startup can do is to increase burn rate on the hopes that it will pay off. You kind of have to, it's slower, but you kind of have to, you kind of got to get the deals and then scramble, is my experience. You get the deals and then scramble operationally rather than be extremely prepared for the sales that you win. I know that's a little bit backwards, but otherwise you get into real trouble if you don't have that perfect fit, or if something takes a year longer than you thought, then you might just be dead. By the time you actually do get that good news.
You'll run out of capital and runway before you even get a chance to fulfill the orders for the new customer that's come in.
Yeah, and grocery stores are the worst offenders of capital, by the way, like capital flow, because they won't pay you back for like 3 months.
Oh, geez, that's tough.
They won't pay you back for 3 months.
Is that part of their agreements too?
Yeah, so you'll ship to them, and then they won't pay you back for the order until 3 months later. And sometimes, I remember one of the first orders that our distributors are the ones who sit between you and the grocery stores. They might service many grocery stores. One of the first ones that bought from us bought like $200K in inventory.
Wow, not bad
for a startup. But for a startup that just raised 2.1. So this was at our series. This was our seed round where we had 2.1. We just raised 2.1 million. We hadn't raised the rest of the money yet. We raised 2.7. No, we raised 3.1 like a year later. But when we raised the 2.1, we got this like 200 something K initial order. And at first, you have to buy all the materials. You got to buy everything. You got to set up all the manufacturing for this. You have to prepay for all the work at the manufacturing site. And then the distance between the cash cycle between outlaying your cash to it getting through to the grocery store, then the 90 days for them to pay you back is $200,000 you just don't have access to. And that's like 10% of the money you just raised.
And that's got to be, you're probably looking at almost 5 months from fronting the cash to being paid back before you see any of that money.
More sometimes, but absolutely.
That to me is absolutely nerve-wracking. Never mind, do you increase your production or do you work with what you have and just delay the order delivery? And again, the 200, was the 200 retail or wholesale? Was it what they...
Wholesale.
All right. So they're seeing a good chunk of change on their side too from that.
Yes. Distributors are...
And distributors take their chunk on top of the grocers.
They take their chunk. Yeah. Groceries are a hard channel.
So, before we wrap this up, I got 2 last questions. And the second to last is, at some point, people started looking at your company and they started seeing it was very interesting and doing well and a great idea. And eventually that led to a buy. And so what was that process like? Someone just gives you a call and goes, Clarence, I got a couple $1 million, I want to buy your company, whatever it is that they end up offering. What's it like?
Yeah. Well, for us, we knew that we were going to aim for a slightly earlier exit. So 5 years end to end is quite short for a startup.
Very short.
So we knew that out of the gates because of a number of reasons. One, personally, we all knew what we wanted to accomplish, which was to change the public sentiment on allergy introduction and to create a beautiful product that helped empower people to do that. We kind of accomplished that. We did accomplish that. Once we got to that moment where we had done that, we thought, we don't really want to be the ones that take this nationally, internationally to such a level where it becomes a distribution and marketing company. Like, we were excited about the product development. We were excited about the changing the course of, allergen increase in the United States. We weren't as passionate about just top line growth after the product had been developed. And we also weren't as passionate about developing new products, because while there were other places we could go, gut health, immune health, brain development, baby foods. There were a lot of ideas that we had in the works, but none felt as real, and none felt like they had the same crisis that we were helping to address. And so we knew that this was probably going to be better in someone else's hands, meaning they would pay more for it than we should just raise more money and build it more. So this was a good inflection point once we demonstrated our sales and the market sentiment. So we got to a point where we were at our Series A, and we're thinking about a Series B. And we had been speaking to some of the larger players like Gerber and Danone and folks. And one of our own strategic investors, Allergies Greer, who was an investor of ours since the seed round, they ended up stepping up and bringing a competitive offer.
Nice.
They were more of a pharmaceutical approach, but they saw what we were doing, and they saw the value in the brand and in the patent architecture, and they wanted a foothold in food allergies. And so what we could provide to them was this growth and this new market access and the patent architecture, and ultimately we had a discussion with a number of bidders, and Allergies Greer ended up being the most aligned with our company values and with just the bottom line.
That's fantastic. So last two questions I want to ask. One is, if there was a chance to do something different that you think would have grown the company exponentially, what would you have changed, or what did you learn starting this business and going through this? This is your first real entrepreneurial push into such a large company. What's something you think you would have done differently that you will make sure you do in your next venture?
Yeah, there's so many things. There's so many mistakes you make throughout throughout the journey. Yeah, that is the point. I would say the biggest thing that we should have done earlier is this idea of the dash day, the going out and speaking to 100 customers and presenting a hypothetical scenario of what the world will look like in 2 or 3 years. So we didn't do that iteration, that like chess game of what the world will look like in 3 years for too long. We basically wasted 2 years. Not wasted, it's wrong. I mean, everybody thinks it could go faster.
Of course.
But we really, for a year and a half, I'd say, we were banging on the drum of the pharmaceutical approach. We made a product that just didn't sell very well when we first did just a peanut allergen. And we just should have spent more time speaking directly to consumers and building exactly what they wanted. We got caught up in what VCs wanted and what the pharmaceutical industry wanted. We got caught up in like the economics of it, because you talk to any venture capitalist in the world and they're like, we need recurring revenues, lifetime value, we need subscription model, we need direct to consumer, we need to engage the medical community and be the industry leader when it comes to all the endorsements that are possible. And that just wasn't true. It just, maybe that was the direction that another company chose, and they did not do well. Interesting. Yeah. But we should have gotten to that point faster, where we realized, hey, let's just ask customers and then deliver a product that delivers value to them. It sounds so obvious when you say it, but when you get caught up in these pitch decks and a VC is like, I'll give you $1.5 million if you make this a subscription-based company, it's so hard to say no.
Well, when you need the capital,
And the seed round was basically blown on doing the pharmaceutical approach and like kind of just not thinking enough in advance about what the world would look like once all the data came out about early introduction. And so if I had to do it again, which I'm sure I will, but for any other entrepreneur out there, I would encourage you to fast forward. If you and other players in the space are all where you are today, where do you think you'll end up in 3 years? And are you happy with your market position when you fast forward? When you hit that fast forward, are you okay with where you end up? And if not, then you've got to change what's core about your business. And that was an exercise that we just didn't do. It almost killed us. But I'm really glad that we ended up doing it, and we just almost did it a little too late.
But I mean, most businesses don't make it. You found that opportunity to realign yourselves and go in the direction you wanted to, which is fantastic. A lot of companies don't have the opportunity to do that. They're too busy chasing the seed round funding and keeping their investors and their board members happy. So it's a fantastic opportunity. You had the chance to do that. Now, the last question I do want to ask you is, I'd love to know what it felt like for you to walk into that Whole Foods or that Wegmans and see your product, see what you've been working so hard on for 2 years. The first time you see that product on a shelf that you can literally, you could always pick it up and touch. You've had them in your offices, but to be in a retail store, in a grocer, and actually touch it and see shelf space, what did that feel like?
Excellent. It was fruit of a lot of hard work from everyone on the team for so long. The first time I actually saw it on a shelf was through a video by one of our brand ambassadors. So we hired a bunch of mothers who wanted some part-time work for a brand that they were really excited about, but working hours are, first of all, big problem out there. Just mothers returning back to work, part-time work is just hard to find. And so we had an awesome person on our team named Jess who just realized that this was something that was a need. Anyway, we had a whole array of brand evangelists that were part-time working moms that were so excited about us. They were so evangelical about our product.
Jess was your CMO, correct?
Yeah. Yes, that's right. And so one of those brand ambassadors was at the grocery shelves of Wegmans, and they were taking a video of the first time that they or any of us had seen it on any shelf. And they were so excited. And the camera was shaking on their phone, and everybody back at the headquarters, we were all just like, oh my God, it's really there. It's so exciting. But we all just fed off of each other's excitement. And what was so heartwarming for me was that we were all excited about it together. It wasn't one person's journey. It wasn't one single entity's, it wasn't like a manifestation of any particular thing. It was just everyone's hard work and everyone's excitement. And you could tell it from the shaky cam of Liz, the brand ambassador at the time. It was so awesome. It was just a really great moment. So I remember that very specifically. Very difficult to forget.
I mean, it has to be. It's such a rewarding, all that work. It's almost like watching your kid take their first steps, which, scary enough, it's going to fly by, and you will be seeing Graham do this. It's going to be, you're going to think back, wow, we had this interview. He was just a month and a half old. Now he's a year old. He's going to be saying mean things to me soon enough. He's going to be taking the car out, and then I'm going to have to worry about college. So, Clarence, I don't know how to thank you enough for coming on the show. It's been an absolute fantastic interview. It was awesome just hearing the story.
For having me.
It was, just to have that full from conception to sale in a 5-year span is almost unheard of. It's such a short span to take an idea. Not only something so powerful that you can really get behind, that you're actually helping people. This isn't like, oh, I'm making a Post-it note holder that goes on the side of a laptop screen, which was an actual product on Shark Tank. And I will actually link to that below because that was absolutely hilarious if no one's ever seen that. But to make something that's actually helping people in helping fight children's or child allergies, you can really get behind it. It's a powerful brand. It's a powerful message, and you can at least know you've done some good while you're doing this entrepreneurial venture. So, Clarence, thank you so much. I can't wait to chat with you again soon enough. And if you're watching now, please, by all means, give us a like and subscribe. If you have any questions, please comment as well. I reply to every comment that you guys leave out there. I love talking to the audience, so please let us know any questions. And if you have questions or suggestions that you'd like to have us bring onto the show, I'd love to hear them too. Thank you so much. Clarence, have a good night.
Nice.
This episode is sponsored by me. I sponsored this episode because I paid for everything. I paid for that lamp. I paid for that camera. I paid for that tripod. I paid for this fill light. I paid for this laptop. I paid for this microphone. You know, I might have actually stolen the microphone. Every penny I save goes into this channel. All right, why is every light on in this house? We're not made of money here, people. So please, help me out and subscribe to the channel. 71, not a chance. Look, every facet of this channel is financed through my own pocket. So every subscribe, like, and comment I personally appreciate. And I will reply to. So please subscribe and help me out. Appreciate it. Listen, people, we are not made of money. If you are cold, put on a sweater.